Did you know that nearly 70% of people with diabetes will develop some form of heart disease? And yet, many of the warning signs go unnoticed, until it's too late. Welcome to Health Hub. If you're living with diabetes or know someone who is, today's video could be life-changing. I'm here to help you uncover the crucial connection between diabetes and heart disease, understand the top warning signs to look out for, and, most importantly, show you how to take charge of your health. We've combined the latest research with practical advice so you can protect your heart and live your best life. Stick around until the end. We'll also bust some common myths and share actionable steps to lower your risk. Let's get started. The diabetes-heart disease connection. So, why are diabetics at a higher risk for heart disease? The answer lies in how diabetes impacts your body. High blood sugar levels over time damage blood vessels and nerves, including those that control your heart. This sets the stage for conditions like high blood pressure, atherosclerosis, and heart failure. A study published in the Journal of the American College of Cardiology found that adults with diabetes are twice as likely to develop cardiovascular issues compared to those without. Even pre-diabetes can significantly increase your risk. This connection is why monitoring your blood sugar, cholesterol, and blood pressure levels is so critical. It's not just about managing diabetes, it's about protecting your heart. Why these signs go unnoticed? Here's the scary part. Many of the warning signs of heart disease are subtle, especially in diabetics. Symptoms like fatigue, shortness of breath, or swelling in the legs can easily be mistaken for everyday issues. This happens because diabetes can damage the nerves that send pain signals, a condition known as diabetic neuropathy. It's why heart attacks in diabetics are often referred to as silent. Instead of chest pain, you might feel something as vague as nausea or excessive sweating. That's why regular screenings, even when you feel fine, are essential. Early detection can make all the difference. Addressing common myths and FAQs. Let's tackle some common myths about diabetes and heart disease. Myth 1. If I manage my blood sugar, I won't have heart problems. While blood sugar control is crucial, it's not the whole story. High cholesterol, high blood pressure, and inflammation also play significant roles in heart disease risk. A comprehensive approach is key. Myth 2. Heart disease symptoms are the same for everyone. Not true. Women, for instance, are more likely to experience symptoms like fatigue or jaw pain, while men might feel classic chest discomfort. Diabetics, on the other hand, might experience no pain at all. Myth 3. I'm too young to worry about heart disease. Heart disease doesn't discriminate by age, especially if you have diabetes. Studies show that the risk can begin to increase as early as your 30s if diabetes is poorly managed. Frequently asked question: what test should I ask for? Great question. Ask your doctor about an ECG, echocardiogram, or stress test, depending on your symptoms and risk factors. Also, regular blood work to monitor cholesterol and inflammation levels is a must. Let's jump right in with the first and most critical warning sign. Top 7 warning signs you must never ignore. 1. Chest pain or discomfort. The silent alarm, ranked number 1 on our list, is chest pain or discomfort. For many people, this is the first sign of an impending heart attack, but for diabetics, it's often overlooked or misinterpreted. Why? Because diabetic neuropathy, or nerve damage caused by prolonged high blood sugar, can dull pain signals. This makes it harder for diabetics to recognize the classic symptoms of heart issues. Chest pain occurs when the heart doesn't get enough oxygen-rich blood due to narrowed or blocked arteries, a condition called angina. According to research by the American Heart Association, diabetics are 2 to 4 times more likely to develop coronary artery disease, a leading cause of chest pain and heart attacks. Instead of sharp, crushing pain, diabetics may experience vague symptoms like pressure, tightness, or even indigestion. A 2020 study published in Diabetes Care found that nearly 40% of diabetics presenting with heart attacks reported atypical symptoms. This makes early recognition and proactive medical consultations absolutely crucial. Why it's ranked number 1, we've ranked chest pain as the top warning sign because it directly signals reduced blood flow to the heart, often requiring immediate medical attention. Ignoring this symptom can lead to life-threatening complications like myocardial infarction, or a heart attack. 2. Persistent fatigue. The invisible burden, next on our list, is persistent fatigue. Now, we're not talking about the occasional tiredness we all feel. This is an overwhelming, daily exhaustion that no amount of rest seems to cure. So, why is fatigue such a big deal for diabetics? Fatigue can result from the heart struggling to pump blood efficiently, a hallmark of congestive heart failure. But here's where it gets tricky. Diabetics often attribute their fatigue to fluctuating blood sugar levels, ignoring the possibility of an underlying heart issue. A groundbreaking study published in The Lancet highlights how chronic inflammation caused by diabetes damages blood vessels over time, reducing oxygen delivery to tissues. This creates a cycle of fatigue and cardiovascular strain. Why it's ranked number 2. Fatigue ranks second because it's a systemic sign that your heart, and overall circulation, may be compromised. While it's less immediately alarming than chest pain, its persistent nature makes it a warning you should never ignore. 3. Shortness of breath. Breathing difficulty explained. Coming in at number 3 is shortness of breath. For diabetics, breathlessness during simple activities like climbing stairs or walking short distances could indicate congestive heart failure, or CHF. When the heart can't pump efficiently, fluid backs up into the lungs, making it harder to breathe. This is called pulmonary congestion. Research from the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, reveals that diabetics are at an increased risk of developing CHF, even without prior heart attacks. If you're noticing unusual breathlessness, don't dismiss it as poor fitness. It could be an early sign that your heart is struggling to meet the demands of your body. Why it's ranked number 3. This ranks third because, while not as acute as chest pain, it signals fluid overload and compromised cardiac function, both serious issues requiring medical intervention. 4. Swelling in the legs, ankles, or feet. A visible warning at number 4, we have swelling in the legs, ankles, or feet. Medically known as edema, this occurs when fluid leaks from blood vessels into surrounding tissues, a clear sign of poor circulation and heart strain. A 2024 study in Circulation highlights how diabetics with poorly controlled blood sugar are more likely to experience fluid retention due to endothelial dysfunction, damage to the blood vessel lining. This not only increases the risk of edema but also worsens overall cardiovascular health. If you notice swelling that worsens throughout the day or is accompanied by shortness of breath, consult your doctor immediately. This could be a sign of worsening heart failure. Why it's ranked number 4, swelling ranks 4th because, while it's a visible sign, it's often mistaken for minor issues like prolonged sitting. However, in diabetics, it can be a warning of severe cardiovascular complications. 5. Irregular heartbeat, arrhythmia. Your heart's SOS signal. Coming in at number 5 is irregular heartbeat, or arrhythmia. This is when your heart's rhythm becomes abnormal, too fast, too slow, or irregular. For diabetics, this can be a subtle yet dangerous red flag. Here's why diabetics are more prone to arrhythmia. High blood sugar over time damages the autonomic nervous system, which controls your heart's rhythm. A 2018 study published in the journal Heart Rhythm revealed that diabetics are significantly more likely to develop atrial fibrillation, a type of arrhythmia linked to an increased risk of stroke and heart failure. What makes this particularly dangerous is that arrhythmia can go unnoticed. Some diabetics report feeling palpitations, dizziness, or chest discomfort, while others have no symptoms at all. This underscores the importance of regular checkups, including an ECG, especially if you have diabetes. Why it's ranked number 5, we've ranked irregular heartbeat as the 5th warning sign because, while it may not be as immediately life-threatening as chest pain, it significantly increases the risk of complications like stroke and heart failure if left untreated. Remember, if you found this helpful, like, share and write your thoughts in the comment of this video and subscribe to Health Hub. We post fresh, easy-to-follow, research-backed health tips every single day to empower you in managing diabetes and living better. Don't forget to turn on notifications. We're here to support your health journey, because your health is worth it. 6. Excessive sweating and nausea. The body's overreaction. Next on our list is excessive sweating and nausea. These symptoms may not seem like they have anything to do with your heart, but for diabetics, they can be silent indicators of an impending heart attack. When the heart struggles to pump blood effectively, it can activate your body's stress response, leading to excessive sweating, also known as diaphoresis. This is often accompanied by nausea as the body redirects blood away from the digestive system to prioritize vital organs. A study in diabetes research and clinical practice found that diabetics experiencing diaphoresis and nausea are 3 times more likely to suffer silent heart attack, an attack without the classic chest pain. Excessive sweating and nausea often appear during episodes of low blood sugar as well. This overlap can confuse diabetics, making it crucial to monitor accompanying symptoms and seek medical advice if anything feels unusual. Why it's ranked number 6? This ranks 6th because, while these symptoms might seem minor, they can precede serious events like a heart attack. Recognizing and acting on them early can save lives. 7. Unexplained weight gain or loss, a metabolic red flag. Finally, at number 7, we have unexplained weight gain or loss. While weight changes are common among diabetics due to blood sugar fluctuations, sudden and unexplained shifts can signal heart problems. Rapid weight gain can be caused by fluid buildup, or edema, when the heart struggles to pump efficiently. On the other hand, unexplained weight loss can indicate advanced heart disease, as the body burns more energy trying to maintain blood flow. A 2023 meta-analysis in the BMJ emphasized that weight fluctuations in diabetics were strongly associated with increased cardiovascular mortality. This makes monitoring your weight regularly a critical part of diabetes management. Why it's ranked number 7. We've placed this warning at number 7 because it's often subtle and misinterpreted. However, when paired with other symptoms, it can indicate severe heart strain or failure. Proactive steps to lower risk. Now that you know the risks, let's talk about what you can do to protect your heart. The good news: small, consistent changes can make a big impact. Keep your blood sugar levels within the target range. This reduces damage to blood vessels and nerves. A study published in The Lancet Diabetes and Endocrinology found that tight blood sugar control can lower cardiovascular complications by up to 17%. Focus on whole foods like vegetables, fruits, lean proteins, and healthy fats. Limit processed foods, salt, and sugar. The Mediterranean diet, in particular, has been shown to reduce heart disease risk by 30%. Exercise strengthens your heart and improves insulin sensitivity. Aim for at least 30 minutes of moderate activity, 5 days a week. Stress and depression can increase inflammation and worsen heart disease risk. Practices like meditation or counseling can help. Work closely with your healthcare provider to monitor your health. If prescribed medications for blood pressure or cholesterol, take them as directed. Conclusion and call to action. Understanding the connection between diabetes and heart disease could be the difference between life and death. By recognizing the top 7 warning signs and taking proactive steps, you're not just managing diabetes, you're safeguarding your future. Remember, your health is your most valuable asset. Don't wait for symptoms to worsen or for a crisis to happen. Start making changes today. If you found this video helpful, please give it a thumbs up, share it with someone who needs to hear this, and subscribe to Health Hub for more life-saving tips. Together, we can turn awareness into action. Congratulations on taking another step toward better health. But wait, it doesn't stop here. Want to know which foods could shockingly lower your sugar levels? Or the secret breakfast ideas every diabetic should try? Don't miss these must-watch videos on your screen right now. They're packed with insights that could change your life. Click one and start your journey to healthier choices today.